Welcome, everyone. Thank you for being here. My name is Brooks Roche. I'm a diabetes education specialist with Diabetes Canada. And I'd like to welcome you and begin by acknowledging that I am joining this webinar from the traditional and unceded territory of the Mi'kmaq people in Prince Edward Island, or Epiquet. So wherever you are joining or watching from, I would invite you to express gratitude and reflect on the land on which we live and acknowledge the past inhabitants of these Indigenous lands. I am so personally and professionally excited to welcome you to this really exciting collaboration between Diabetes Canada and the Canadian Celiac Association. And I'd like to sincerely welcome our guests from the CCA, who I will hand it over to you too.
Hi, Brooks. Thanks so much for having us today. My name is Nicole Byrom. I'm a dietitian and health promotions manager with the Canadian Celiac Association. And I'm coming to you today from rainy and wet North Vancouver.
Awesome. And my name is Emily, and I'm the dietetic intern at the Canadian Celiac Association. I'm a graduate student at the University of Guelph, currently completing a Master of Applied Nutrition en route to becoming a registered dietitian. And today I am joining you from Guelph, Ontario.
Okay, thank you so much for being here. And I will happily hand it over to Nicole to walk us through some information and answer some key questions around the connection between celiac disease and type 1 diabetes.
Okay, well, thank you so much today for this opportunity. This is such a learning experience, I think, for all of us. So I'm going to share my screen now and just go through my presentation that we've got prepared for you. So bear with me for 2 seconds as I share the screen and get it just set up here. Brooks, you need to give me permission to share my screen.
Okay, bear with us, everyone. It is not a webinar without some sort of Zoom malfunction.
Living life now in the post-pandemic world where everything is on computers. There we go. Thank you so much. All right. Here we go. Everybody see that okay? Emily, you can see that okay? Yeah?
Yeah, you're good.
Okay, so as mentioned, we are, my name is Nicole Byrom and I'm from the Canadian Celiac Association. I'm gonna okay, so what is celiac disease? So celiac disease is a common disorder that is estimated to affect about 1% of the population. It is a condition in which the absorptive surface of the small intestine is damaged by a substance called gluten. Gluten is a group of proteins present in wheat, barley, and rye, and their crossfed grains. Celiac disease is an autoimmune disease and not a food allergy as many may think. Here you can see the visual representation of villus atrophy that occurs in those with undiagnosed or newly diagnosed celiac disease. This slide demonstrates the effects of damage over time on the intestinal lining. You can see how the absorptive surface becomes flattened and have less surface area available to absorb nutrients. Here you see at 0, we have a normal intestinal lining, and with each new phase comes further mucosal damage, hindering nutrient absorption as the stages progress and damage continues. As mentioned in the previous slide, celiac disease is not an autoimmune disease. Therefore, requiring gluten-free foods is not a choice. This is not a fad diet, and people are not choosing to be on this. Celiac disease is a serious, lifelong commitment with serious health complications associated with the consumption of gluten. Damage leads to a variety of symptoms and can result in the inability of the body to absorb protein, fat, carbohydrate, vitamins, and minerals. As I mentioned, celiac disease is an autoimmune disease. As such, celiac disease can run in families. For example, in my family, my mother and daughter both have celiac disease. And in addition, my husband, his sister, and his niece have all been diagnosed. We are living proof of the genetic predisposition of celiac disease. If you have a first-degree relative with celiac disease, you should be screened. For people with no family members with celiac disease, the incidence of diagnosis is about 1 in 100. And for those with a first-degree family member, the risk increases to about 1 in 10. I'm now going to introduce you to Emily Kuehl, a dietetic intern working with the CCA. Emily is going to go over diagnosis and treatment of celiac disease with you now.
Diagnosis of celiac disease happens in 2 steps. The first step is screening. Screening for celiac disease occurs through a serological test, otherwise known as a blood test. This test will look for elevated levels of the IgA tissue transglutaminase, or TTG, antibody. It is important to remember that during screening, individuals must be eating gluten. If we have celiac disease, gluten intake will trigger TTG antibodies, and this will be visible in our test results. The second step involves a small intestinal biopsy, or possibly a skin biopsy in the case of dermatitis herpetiformis, which is celiac disease of the skin. A biopsy is performed by a gastroenterologist using a tool known as an endoscope. Your doctor will take samples using the endoscope to identify if there is damage to the small intestine. This procedure takes around 30 minutes and is not painful. A diagnosis of celiac disease must be confirmed by a biopsy. Unfortunately, there is no cure for celiac disease. Treatment involves following a strict and lifelong gluten-free diet. Since this type of diet is restrictive, it is important that individuals following a gluten-free diet receive nutrition education from a trusted professional. Registered dietitians who are trained in celiac disease can help individuals ensure they are meeting their nutritional needs while enjoying their meals and following a gluten-free diet. While learning the ins and outs of a gluten-free diet can be challenging, the Canadian Celiac Association is here to help. We are a trusted organization that provides Canadians with an abundance of free and accessible resources on celiac disease, the gluten-free diet, and other dietary considerations. It is estimated that approximately 1% of Canadians have celiac disease. This is close to 350,000 Canadians. However, we suspect that this number is actually much higher. Why is this? Well, approximately 2.2 to 5 million Canadians are at risk of celiac disease or gluten-related disorders. On top of this risk, it takes an average of around 10 years to get diagnosed with celiac disease. Celiac disease is common all over the world, and its prevalence is only growing. In fact, Canada has had an increase of around 35% in celiac disease prevalence over the past decades, which is the greatest increase recorded. Due to the high risks of celiac disease in many populations and a lengthy diagnosis period, it is estimated that 85% of Canadians with celiac disease are undiagnosed. This is a huge proportion of individuals who are suffering and potentially sustaining long-term damage to their health. The best way to improve this number and advocate for your health is by simply getting tested for celiac disease.
Okay, thank you, Nicole and Emily. And I think now we're going to veer a little bit into the type 1 diabetes realm. And what we'll hear about next is actually how these two are related. But type 1 diabetes, in essence, is an autoimmune disease. So once again, the distinction here is type 1 diabetes makes up about 10% of cases of diabetes. So the vast majority being type 2 and a small minority also being gestational diabetes. But what we're talking about specifically is type 1. So this is essentially where the immune system reacts against the beta cells of the pancreas, which they have the intent of producing insulin. Insulin is a hormone, as many of our viewers know, that helps to control the level of glucose or sugar in the blood. So if a person lives with type 1 diabetes, like myself, they need to inject or pump insulin subcutaneously to regulate their blood glucose. And again, as many of our viewers may know, blood glucose is not just impacted by food. It's a multitude of factors: food, exercise, sleep, stress. Sometimes it feels like the weather has an impact on it. And essentially, this is a common myth that we actually encounter. And this is, again, to the point of it being really difficult, to the point of celiac disease being a long developing disease with a lot of complexity in it. Generally speaking, type 1 diabetes does develop in childhood or adolescence, but it can develop at any time because by its nature, it is an autoimmune disorder. And there's a lot of misconception around this being somehow caused by an individual or curable or easily treatable. It's again, like celiac, it requires lifelong lifestyle interventions. Nicole, mute alert.
Thank you. I'd like to introduce you now to Annie Pettigrew. Annie is 16 years old and is a youth ambassador and national youth champion for the Juvenile Diabetes Research Foundation of Canada. Annie has done a lot of work in advocacy and government relations for the JDRF. Annie is living with both celiac disease and type 1 diabetes. We'd like to share her story with you now.
My name is Anne Pettigrew. I was diagnosed with type 1 diabetes almost 5 years ago on January 31st, 2017. When I was diagnosed with type 1, I remember my mother saying, in an attempt to comfort me, that at least I didn't have celiac. I mean, I had to have an insulin shot at every meal, sure, but at least I could eat what I wanted. My diagnosis of type 1 definitely made me think about food a lot more, and it made me more grateful than ever that I could choose what I wanted to eat. Then, 2 years and 6 months later to the day, I was diagnosed with celiac disease. It was something I never saw coming, something I never thought to worry about. I didn't know that having type 1 had put me at higher risk for celiac, but I had known for months before I was diagnosed that something was wrong. My energy levels gradually declined to the point where I got breathless walking up the stairs. Everything was exhausting. No amount of sleep made it better. I became aware of how tired I was in April, but I didn't get blood work done until July, so I wasn't diagnosed until July 31st, 2019. It felt like the end of everything. My heart broke for everything I was losing: my freedom, my control, my independence, and my usual subway order, which I still have memorized because it was just that good: 6-inch pizza sub toasted on Italian bread with lettuce and needing 1.5 units of insulin to cover it for me personally. Perfection. And gone. So much was gone, and so quickly. And then, 3 weeks later, my heart broke again for my little brother Christopher, who was also diagnosed with celiac. I honestly cried harder for him than I did for myself. Together, we said goodbye to the foods we had to leave behind, and to a lot of traditions that had centered around them. It was hard, and it took time. It's still taking time. But 2 years later, we're finding new traditions, and we're looking forward, and we're not taking a minute of it for granted because we know all too well how quickly something can disappear. Nobody in my family has type 1 except for me. Nobody else has celiac except for us. We're the first, and hopefully the only. With our new traditions and new lifestyle both being centered around our gluten-free diet, we're thankful for how far things have come in terms of gluten-free options. We've come so far from even just 2 years ago, and new gluten-free alternatives are coming out all the time, so we really do have a lot to look forward to. The hardest part about managing the gluten-free diet for us personally is actually not the food itself, but just making sure that there's no cross-contamination with gluten. Sometimes people just don't understand how serious it is. With type 1 too. And I didn't understand either before I was diagnosed. It's why raising awareness for celiac and for type 1 is so important, because it will only lead to increased understanding of both diseases. But when people don't understand, you have to be your own advocate, and you have to do what you know is best for you. And that can be hard, but you have to believe in your strength. On the hardest days, you have to believe in your strength. If you think you might have celiac, but you're scared to find out for sure, or if you've just been diagnosed and it feels like you've lost everything, you have to believe in your strength and ability to get through it, because you can and you will. Things will get better. You are not alone. As someone who has had 2 life-changing diagnoses, I know how completely awful it feels to not be in control. But I got it back, and you will too. With the support of friends, family, and other people in the celiac and diabetes communities, we're all here, and we all get it. And the Canadian Celiac Association and Diabetes Canada are here for us too. Keep your head up and stay strong. Thank you.
I want to thank Annie for sharing her stories with our communities. I know that each one of us watching today has our own story to share as well. And as Annie said, I want to remind everybody that both the Canadian Celiac Association and Diabetes Canada are here to support you and help you with any of those needs. So please do reach out. So what is the connection between celiac disease and type 1 diabetes? Why have we come together today to discuss these otherwise apparently different diseases? Or are they so different? Here are some facts. Both celiac disease and type 1 diabetes are autoimmune diseases with shared genetic components. Both celiac disease and type 1 diabetes worldwide incidence are increasing. This suggests that not only do genetic factors play a role, but also environmental factors. The prevalence of celiac disease in those with type 1 diabetes is 5 to 7 times higher than the general population, telling us that those diagnosed with type 1 diabetes are at increased risk for developing celiac disease. Diet plays a very important role in the management of both of these diseases. Research has shown us that people with type 1 diabetes, when diagnosed with celiac disease, are often asymptomatic, or if symptoms do present, they may be mild. In addition, some people with type 1 diabetes who have been undiagnosed with celiac disease will reference unexplained hypoglycemia as a primary symptom. This slide demonstrates how celiac disease and type 1 are genetically predisposed, but also have an environmental component. This slide also shows that those living with type 1 diabetes are at increased risk for developing celiac disease. However, the inverse relationship does not appear to be true. Those with existing celiac disease do not appear at this time to be at higher risk for developing type 1 diabetes. An example of genetic links with both celiac disease and type 1 diabetes are shown here. Here we examine identical twins. For identical twins, where one has celiac disease, the likelihood of the other to develop the disease is 75%. For identical twins with type 1 diabetes, the likelihood of developing type 1 is 42% when one identical twin presents with the disease. This demonstrates that genetics play a large role in the development of both of these diseases. On the next 2 slides, I will run a few comparisons between type 1 diabetes and celiac disease. Here we have some interesting facts. We know the causative agent for celiac disease. This is gluten. If you never introduce gluten into your diet, you won't develop celiac disease. We have not found one for type 1 diabetes, however, although viruses and environmental factors are suspected and are being examined as possible causative agents. The clinical presentation of both diseases vary. Celiac disease symptoms may appear before histological damage has begun, whereas with type 1 diabetes, symptoms appear later in the disease progression. We know that there are overlapping genotypes in both of these diseases. Type 1 diabetes and celiac disease share some certain common symptoms. This makes diagnosis difficult for some people with type 1 diabetes. As symptoms overlap, they can mask symptoms of celiac disease and make them appear silent. These overlapping symptoms include weight loss, fatigue, reduced bone density, and growth failure. It is also noted that for those with type 1 diabetes, recurrent hypoglycemia is a common symptom of celiac disease. I will note one difference. Diagnosis for celiac disease can be made at any age. Previously working in long-term care, I saw people diagnosed into their 80s. And as a mother who had a daughter diagnosed at 5 and a mother diagnosed in her late 50s and a husband diagnosed in his 40s, I've certainly seen that this is true. Type 1 diabetes peak incidence is in early adolescence. However, as Brooke mentioned before, it can be diagnosed at any time as well. Worldwide incidence for both diseases is approximately 1%. So all of this being said, what do we recommend? It is suggested that for those living with type 1 diabetes of all ages who have symptoms suggestive of celiac disease be tested, regardless of previous celiac disease screening. Remember that unexplained hypoglycemia may be a symptom of celiac disease. An IgA level is recommended as part of your blood work to rule out an IgA deficiency. Now, if you have an IgA deficiency, the results from your celiac screen can be a false negative. So be sure to ask your doctor to add that in. Of note, most pediatric type 1 diabetic patients who develop celiac disease, will do so within the first 5 years of diagnosis, although celiac disease in adults is also well recognized. So what's the bottom line? Get tested. We suggest that you be tested for celiac disease when you're first diagnosed with type 1 diabetes, and annually thereafter for the next 4 years. Here it gets a bit complicated. After this time, you can decrease your testing frequency to every 2 years and do this for the next 6 years. We suggest you be tested at any point in time in your lifetime if you do present with symptoms. Thank you so much to everybody for watching us today. Now we have time for some questions.
Okay, fantastic. And thank you both, Nicole and Emily, for walking us through. I always find it fascinating to learn just how interconnected the web of, let's call it comorbidities, or how, in this case, type 1 diabetes connects so closely with celiac disease. So we would like to open the floor to questions. So anyone who is watching on Facebook, please do feel free to submit your questions in the chat, and we'll be happy to answer them. And one that I'm curious about, and I'm wondering if Nicole and or Emily, you could provide some perspective on this. And it's, we hear a lot about these sort of, this is broadly what the symptoms look like, or this is, when there's a lot of overlap, for example, in how symptoms show up, or the fact that this celiac disease takes so long to diagnose. I'm curious in, maybe Nicole, in your professional experience, what should folks look out for as just sort of personal, the feeling that they should look out for? What are symptoms at the real individual scale that folks might look out for as a warning sign, or that you've seen at the point of diagnosis?
So it's interesting. I mean, I think there's noted to be about 300 symptoms of celiac disease, and they're very, very individual. So for example, just from my own personal family, my daughter presented with severe skin rashes and upset tummy, bloated, hard upset tummy. My husband, who is a firefighter, presented with dizziness. And he was actually really concerned before he was diagnosed with celiac disease as to why he was having these dizzy spells and if it would affect his career. So was quite happy when we found a cause of these dizzy spells. That was his primary symptom. My mom lost an incredible amount of weight before she was diagnosed. She dropped about 20 pounds over a year and had no idea why. So presentation of symptoms varies. Certainly the GI symptoms are the most obvious. People who have upset stomachs, bloating, gas, diarrhea, constipation, those ones are kind of what we call the typical symptoms. Our more atypical symptoms, we see things like increased liver enzymes. We see anemia. We see osteoporosis, osteopenia, so bone loss, increased risk of bone fractures. So young people in their 40s having frequent fractures. Sometimes that will be seen. In children, we see delayed growth. We see delayed puberty. We see dental enamel defects. So we've got something that we call the celiac iceberg. And if you think of an iceberg, the tip of the iceberg is above the water, and that is about the people who we have actually diagnosed. The rest of them are under the water. The ones above are with the more obvious symptoms, and the ones below are with the more atypical symptoms. So the symptoms vary. And if you do wonder about celiac disease, we do have a symptom checker on our website. And our website is www.celiac.ca. And on there, you can look up our symptom checker and go through that and see if maybe you should be tested.
Yeah, that's fantastic. And I think we do have a question, so I'll pose it to you folks, and it's, can changes in the blood sugar or trends be connected to this combination of celiac and type 1? So basically looking at, you had mentioned this prevalence of hypoglycemic events in folks who live with celiac. Does this show up as sort of a change in trend, or if folks are noticing something that feels dramatically off, might that be a sign of comorbidity?
Yeah, so certainly, when we look at the science, it's showing that unexplained hypoglycemic events are one of the risk factors for celiac disease. So if you're finding that trend, then that is a reason to go in and get screened.
We have another
opposite direction. Sorry.
Okay. There's another question, and it's what percentage of people with type 1 diabetes have celiac disease? And this is, I can speak to this, and it's that because it's about 6 times the likelihood, as we were discussing in preparing for this webinar, Nicole. So overall in the population, about 1% of the general population lives with either condition. But if someone lives with type 1, about 6% of that population does live with celiac. So it's about 6 times increased likelihood of developing celiac in the event that person lives with type 1. So short answer, 6% of people with type 1 have celiac. Another question is wondering around, is there an effect on carbohydrate absorption with celiac disease?
So certainly, if you think back to the slides that we presented, and I like to describe the gut, in kind of layman's terms. If you think of the gut as a shag carpet, right? And you've got all of the villi, and you've got a lot of absorptive surfaces. So a healthy gut is like a really good shag carpet where there's lots of surface area for all of our nutrients to absorb. Over time, those get dulled down and blunted. And so what happens is we see lactose intolerance. So one of the first symptoms, because lactase lives at the end of the villi. And so when those get dulled down, often we see people have lactose intolerance. So if you do find, that's another symptom to look out for. If you do find that you're becoming lactose intolerant, that's something else that could be triggering possibly to go and get screened. So over time, these get blunted down, and eventually, as you would have seen in slide 4, it becomes more smooth because it's been really glued down. So everything is being poorly absorbed at that point. So this could be one of the reasons for that hypoglycemia, because things are not getting absorbed in. So yes, that would be one of the concerns.
Yeah, thank you. And that is fascinating. The metaphor of the shag carpet is a really helpful one. I don't know if I've ever heard the term really good shag carpet before. It might be an oxymoron, but
it might be. And then the linoleum is stage 4. Generally, that's what I say. It goes from shag carpet to linoleum. So an equally 60s reference.
There's someone wondering about long-term effects of undiagnosed celiac in type 1. So wondering specifically if someone does live with type 1 diabetes and they haven't identified that they also live with celiac, what can that lead to over the longer term?
Yeah, so the risks would be the same as for somebody. I'm going to I can speak to the risks for somebody with long-term undiagnosed celiac disease. I'm not sure. I'm assuming that the relationship with type 1 would be the same for long-term effects. So certainly we look at the big ones, which are anemias, so iron deficiency anemia, so exhaustion, fatigue. Osteoporosis is the other really big one, and then certain types of cancers is the other one.
Okay. We have someone who's wondering if celiac disease can contribute to sensitivities to other foods.
As I mentioned, definitely we see it with lactose intolerance. So for somebody with celiac disease or early stage celiac disease or undiagnosed celiac disease, we see dairy intolerance quite a bit because of that lactose, and because that lactase enzyme, which digests lactose in dairy products, is missing or diminished, we see an intolerance often to dairy products. As for other food intolerances, definitely across the board, different people have different experiences, but dairy and lactose is the big one for our community, but certainly individual people will have other experiences.
And it's really fascinating to explore, I think, just how far this reaches, from one disease into another, how different conditions tend to overlap. I'm not seeing any more questions, but before we wrap up, I would just like to ask each of you if there's anything else that you'd really like to share or leave viewers with. If folks left with one new piece of information, what might it be?
I think I would like to speak to vitamin, oh, sorry, I'm pressing a button here. I'd like to speak to vitamin D just slightly. So vitamin D deficiency is another one that we see in our community quite often during, at diagnosis. My daughter was vitamin D deficient, continues to be vitamin D deficient. My husband was also noted to be vitamin D deficient. Now, vitamin D deficiency across most Canadians is common, purely based on our latitude. So we cannot absorb vitamin D from the sun between the months of October and May. The angle of the sun's rays they're not strong enough to allow our body to convert vitamin D2 to its active form D3, which is what we need. So we are often recommending, and as a dietitian, we're consistently recommending to the Canadian population to supplement with vitamin D. So this is true also for our celiac population, who often go into this with a deficiency. So what does that supplementation look like? For adults, it's about 800 to 1,000 IUs a day. And for children, it's more 400 to 800 IUs a day. So between the months, again, of October and May, we suggest, if you're not getting enough through the diet, and it can be hard to get vitamin D in the diet, milk, of course, is fortified. Some orange juices are fortified. You can get vitamin D in salmon bones. Emily, what am I forgetting? Eggs have a little bit of vitamin D in them.
Did you say margarine?
Margarine can be fortified. So often in our foods, we've developed fortifications specific to Canadian needs. For example, iodine is fortified into table salt for specific needs for thyroid. So vitamin D for our population is recommended to be, if you're not getting enough in your dietary sources and you're not outside in the sun throughout May to October. So when you think, well, our typical way of getting vitamin D is through sunshine. We go outside, but quite often now we're covered in sunscreen, we're wearing hats, or we're working indoors. So we're not getting what we used to get when we were outside. People were more, historically people were gathering food, working in fields, getting that sunshine, because that vitamin D is a fat soluble vitamin. So it would store through the winter, whereas now we're not getting those stores built up through the summer. And so we're suggesting more supplementation through the winter. So something certainly for both of our communities to focus on. And then the next thing, of course, would just be, if you do have any questions, to connect with us, check out our symptom checker. If you're wondering if your symptoms may be and you're still not sure, give us a call, connect with us, and we're happy to help you.
And I'll just add to that, that there's a lot of misconceptions out there about a gluten-free diet and nutrition in general. So I would just take this opportunity to remind everyone that if you do have questions, please trust reliable sources like the Canadian Celiac Association, like Diabetes Canada. They are providing accurate, evidence-based information, and that's really, really important. So trust good sources.
And I will add to that, please do get diagnosed with the appropriate channels. If you go on a gluten-free diet just to see how you feel, that is not going to be an official diagnosis. And the risk of not getting an official diagnosis is, when you are officially diagnosed with celiac disease in Canada, you can apply for tax credits. So without that diagnosis, you're not going to be eligible for those tax credits. And the other piece of that is, if there's a medication, and one day there will be a medication available, we hope, to not necessarily treat, long-term celiac disease, but possibly treat accidental exposures to gluten. So in our community, if there's cross-contamination from a restaurant, or if you accidentally if you're living in a shared kitchen at home and there's been a cross-contamination, then you can get very sick. So my daughter in particular is an extremely sensitive celiac. She will get very, very sick from even the smallest cross-contamination. So if a medication comes out one day, you know, it would be wonderful for her to be able to take something to help just ease that moment of time. If you don't have that official diagnosis, the wonder is whether you'll be eligible to receive that medication. So please do go through the appropriate channels, go to your doctor, request the blood work before you stop eating gluten. If you are eating gluten and you do the test, it will be accurate. If you are not eating gluten, the test can be a false negative. And we don't want you to get that wrong. We don't want you to get the wrong results. So please do it through the appropriate way. Don't just try the diet to see how you're going to feel, because if you feel a lot better and you have to reintroduce gluten, the gluten challenge can be difficult for people.
Yeah, thank you, folks. And I really appreciate the idea of, getting tested and doing so through reliable sources, to do so formally, if you want to call it that. And I would just offer a bit of advice specifically to our type 1 audience. And that is, it can be very overwhelming. I'm thinking myself, if there are, as you mentioned, Nicole, 300 potential symptoms, it can often be, well, maybe it's, who knows what I might be dealing with. It may be just an offhand bad day, bad week, bad month of life with type 1 diabetes. But if you do feel, I would direct people as well to the symptom checker, and we'll be sure to share that in the video description. Check it out and see if it merits getting checked out formally, getting diagnosed, because as we can see, it can really spare you a lot of longer term difficulties, because it's incredibly hard to live with one chronic illness, let alone two, but it can be made easier if you actually seek help formally. So on that note of trusting veritable sources, Diabetes Canada, as mentioned, is doing a lot of work to support you. This cause in particular, we're super happy to be partnering with CCA on this cause. And if you do have questions that you feel are more specifically diabetes focused, you can visit our website, diabetes.ca, our social media. And if you want to get specific advice for yourself, or at least get put more in the right direction, you can call our helpline at 1-800-BANTING, or you can email info@diabetes.ca for any questions. You can also get in touch with CCA, of course, and Nicole can point you in the right direction there.
Yeah, so if you'd like to reach out to the CCA, our email address is info@celiac.ca. Our website, as mentioned earlier, is www.celiac.ca. And if you wanted to speak to one of our team members on one-on-one, so you can call our number, and I actually return the phone calls. So if you have any questions specific for me as a registered dietitian, please feel free to call 1-800-363-7296, extension 224, and I'm happy to return your calls. And we of course have Twitter and Instagram and a really active 16,000 plus Facebook group as well. So please join that.
That is awesome. It's not every day that you get someone as knowledgeable as Nicole giving your personal extension. So if you feel like making use of that, I would recommend it. I know I personally learned a lot on this in this conversation. I'm really, really thankful to both of you for being here and sharing what you know. I hope it's been helpful for those watching as well. So I want to give a sincere thank you, Nicole and Emily, for your time and all your input on this. It's really important work that you're doing. And to everyone watching, thank you as well. So please feel free to contact either of us for any further information and to be connected to some of our experts. So thank you very much and take care, everyone.
Wonderful. Thanks so much, Brooks, for this opportunity today.
Thank you.